There's a gland in your neck the size of a butterfly, and right now it might be slowly failing, dragging down your energy, your mood, your hair, and your skin without you ever knowing why. It's called the thyroid, and when it stops working properly, your entire body pays the price. Over 20 million Americans have some form of thyroid disease, but here's the alarming part. Up to 60% of them have no idea. They blame stress, they blame aging, they blame bad sleep. Meanwhile, their thyroid is sending visible warning signs that most people completely miss. Today, we're breaking down 10 signs of an underactive thyroid you can actually see on your skin, your nails, your face, and your hands. Some of these are so subtle, you've probably ignored them for years. Others are so striking, they demand immediate attention. And if you stay until the end, I'll show you the one red flag that signals a life-threatening emergency where up to 60% of patients don't survive. Now, this video is purely educational. It's designed to help you recognize patterns, not to diagnose yourself. If any of these signs sound familiar, that's your cue to see a doctor and get a simple blood test. Knowledge gets you in the door. Your doctor gets you the answers. Let's begin. The butterfly swelling. Your thyroid sits at the base of your neck, just above your collarbones. Normally, you can't see it, but when it's struggling, it grows. Here's the mechanism. Your brain constantly monitors thyroid hormone levels. When levels drop, it releases TSH, thyroid stimulating hormone, telling the gland to work harder. But if your thyroid can't keep up, your brain keeps pushing. More TSH, more growth signals. The gland swells larger and larger, desperately trying to produce what it cannot. This visible swelling is called a goiter. In severe cases, it can compress your windpipe and esophagus, making it hard to breathe or swallow. Try this: grab a mirror and a glass of water. Tilt your head back slightly, take a sip, and watch the base of your neck as you swallow. Your thyroid moves up and down when you swallow. If you see a visible bulge or feel unusual fullness, that's worth investigating. The crumbling wall. Your skin is your body's first defense. Think of it like a brick wall. Dead skin cells form the bricks, and natural oils act as the mortar holding everything together. An underactive thyroid dramatically reduces oil production. Without that mortar, the wall starts to crack. Research from the Journal of Clinical Endocrinology shows that hypothyroid patients often develop a distinctive pattern called eczema craquelé skin, so dry it resembles cracked pavement. The texture becomes rough, the surface flakes, and no amount of moisturizer seems to help. If your skin has become persistently dry and rough, especially on your shins, arms, and hands, your thyroid might be running on empty. The shedding crisis. Here's something most people don't realize: at any given moment, about 10% of your hair follicles are in a resting phase, preparing to shed. That's normal. But when thyroid hormone drops, that cycle breaks down. First, new hair production slows. The strands that do grow become thin, brittle, and dull. Then something worse happens: follicles enter the resting phase prematurely, all at once. Within months, you can lose massive amounts of hair. The American Academy of Dermatology documents cases where patients lost nearly all their hair in just 4 months due to undiagnosed hypothyroidism. The good news: this type of hair loss is often reversible. Once thyroid levels normalize, many patients see significant regrowth within a year. The nail betrayal. Your nails are 90% keratin, the same protein that builds your hair. So, when your thyroid struggles, your nails suffer too. The growth process becomes slow and disorganized. Nails may thicken, but the quality is poor. They become brittle, crumble easily, and develop thick vertical ridges. Another telltale sign is onycholysis, where the nail separates from the nail bed. Air gets trapped underneath, giving the nail a white or yellowish appearance. Look at your fingernails right now. Do you see ridges running from base to tip? Are the edges splitting or peeling? These small changes can signal a bigger problem underneath. The vanishing eyebrow. This one is a classic diagnostic clue that doctors have recognized for over a century. It's called Queen Anne's sign, named after Queen Anne of Denmark, and it describes the thinning or complete loss of the outer third of the eyebrow. The hair follicles at the outer edges of your eyebrows are particularly sensitive to thyroid hormone. When levels drop, these follicles go dormant first. Stand in front of a mirror. Compare your eyebrows now to photos from a few years ago. Has the outer portion become noticeably thinner or disappeared entirely? Many people assume this is just aging. Often it's not. The swollen mask? If your face looks puffy, especially around the eyes and cheeks, it might not be water retention or lack of sleep. In hypothyroidism, a gel-like substance accumulates in the skin. This condition is called myxedema. Unlike regular swelling that feels soft and leaves an indent when you press it, myxedema feels firm and doughy. This same substance can build up around your eyes, creating persistent bags that don't improve with rest. It can thicken your lips, enlarge your tongue, and give your entire face a swollen, mask-like appearance. The texture is the key. Press gently on the swelling. If it doesn't indent, if it feels almost rubbery, that's a red flag worth checking. The orange tint. This sign catches most people completely off guard. Look at your palms. Now look at someone else's. Is there an orange or a yellowish tint to your skin, especially on your palms and soles? This is called carotenemia. Here's what's happening. Beta-carotene is the orange pigment found in carrots, sweet potatoes, and pumpkins. Normally, your body converts it into vitamin A, but hypothyroidism slows down that enzyme. The result, beta-carotene builds up in your bloodstream and deposits into your skin, particularly in areas with thicker skin like your palms and the soles of your feet. The buildup itself is harmless, but it's a visible marker that your metabolism isn't functioning properly. The tingling hands. Do your fingers go numb or tingle, especially at night? You might have carpal tunnel syndrome, and your thyroid could be the hidden cause. The carpal tunnel is a narrow passage in your wrist where nerves and tendons pass through. When hypothyroidism causes tissue swelling, that tight space gets even tighter. The median nerve gets compressed. Numbness, tingling, and pain follow. According to clinical data, up to 5% of all carpal tunnel cases are caused by an underactive thyroid. That's significant because treating the thyroid can resolve the symptoms without surgery. Try Phelan's test press, the backs of your hands together, fingers pointing down, and hold for 60 seconds. If you develop tingling or numbness in your fingers, it may indicate nerve compression. The endless chill. Some people just run cold. But there's a difference between preferring warm weather and feeling cold when everyone else is comfortable. When your thyroid is underactive, your metabolism slows. Your cells produce less energy. Less energy means less heat. Think of it like your body switching to low-power mode, doing only the bare minimum to survive. You might wear layers in summer, bring blankets to air-conditioned rooms, or never seem to warm up no matter what you do. If cold intolerance has become part of your identity, it's worth asking whether your thyroid is the reason. The silent fog. This sign doesn't show up on your skin, it shows up in your mind. Low thyroid hormone directly affects your brain chemistry. Research published in JAMA Psychiatry shows that hypothyroidism decreases serotonin and dopamine, the neurotransmitters responsible for mood motivation and mental clarity. The result can feel like depression, brain fog, difficulty, concentrating, or emotional flatness that doesn't respond to typical interventions. This is why mental health screening should always include a thyroid panel. Sometimes the fog isn't psychological, it's hormonal. Now the warning I promised. This is rare, but when it happens, it's deadly. Myxedema coma occurs when severe untreated hypothyroidism pushes the body past its breaking point. Heart rate drops, breathing slows, body temperature falls dangerously low. The brain becomes confused. Organs begin to shut down. One documented case involved a 56-year-old woman who arrived at the emergency room confused in hypothermic core temperature, just 34 degrees Celsius. Her photos showed every sign we've discussed: thinning hair, swollen face, thickened skin, brittle nails. Even with aggressive treatment, IV thyroid hormone intensive care, life support, up to 60% of patients with myxedema coma don't survive. She was one of the lucky ones. After treatment, she made a full recovery. Photos from 1 year later show a completely different person. Now, beyond what you can see, there are symptoms. You feel constant fatigue that sleep doesn't fix, stubborn weight gain despite eating well, and chronic constipation. These are common, they're vague, and they're easy to dismiss. Don't ignore them, especially if they appear alongside the visible signs we've covered. Your thyroid doesn't scream, it whispers. And the signs we've covered today are those whispers, visible clues your body is asking you to notice. If even one of these signs sounds familiar, consider getting a simple blood test. TSH levels can reveal what's happening beneath the surface. And if there's a problem, treatment with thyroid hormone replacement is straightforward and effective. Knowledge is your first line of defense. Your doctor is your second. If this video helped you understand your body better, share it with someone who needs to hear it, a friend, a parent, a partner. Might be the wake-up call that changes everything for them. Subscribe and hit the notification bell. We're just getting started uncovering the signals your body is sending. Stay aware, stay proactive. Your body never lies. Learn to read it.